presentation includes the slides which are complementary, the figures, to my video presentation on Ballet, an excellent non-pharmacological therapy for alcohol use disorder. While reading in the literature about the problem, I found some very nice figures which I include. I also wrote some things and would like to share in addition to make this presentation clear and more convincing. I always think it is good to have visual information. I mentioned in my video presentation that alcohol is very noxious to the brain and the body, and that no amount of alcohol is safe. Even a small amount can be very toxic. And alcohol is toxic through all ages. In this slide, I included a nice figure from the NIAAA, National Institute on Alcohol Abuse and Alcoholism, where you can get more information about the noxious effects of alcohol, such as it causes brain damage. It damages the brain cells, and also it causes atherosclerosis, cognitive impairment, dementia, anxiety, depression, and delirium are some of its toxic effects for the brain. It causes cardiovascular disease, high blood pressure, cardiomyopathy, as I mentioned, atherosclerosis. It causes different stages of liver disease, inflammation, cirrhosis. It can cause damage of the pancreas, inflammation, and diabetes. And it has been found to cause many different cancers. This is one of the great dangers from drinking alcohol, and no amount is safe. It weakens the immune system so that people become more susceptible to infections or heal slower from infections. Alcohol causes muscle wasting and damaging of the endocrine system and the reproductive system, both in women and in men. And because alcohol is excreted through the kidneys also, it can cause kidney damage. So the situation is very serious. Here, in this figure, I want to highlight, again from the NIAAA, the 3 stages of alcohol use disorder, or as also is known, alcohol addiction, and the brain regions involved. The first stage is called the binge intoxication stage, and it is associated, as I already mentioned, with the development of incentive salience neurocircuits, which link the pleasurable, rewarding experience of drinking with cues, such that the cues gain motivational significance. And these and other neurocircuits help to develop and strengthen habitual drinking. And a brain structure involved here are the basal ganglia. The basal ganglia are also important for habit formation and for dance, for movement. The second stage in alcohol use disorder is the withdrawal or negative effect, and it is associated with states such as anxiety, dysphoria, and irritability. And a person needs alcohol to find relief from the discomfort and emotional pain. And the brain region involved are the extended amygdala. And I want to mention that the amygdala are also involved in ballet, which allows for emotional expression and reduces anxiety and irritability. And the third stage is the preoccupation or anticipation stage, and it is associated with executive function control and the prefrontal cortex. And the prefrontal cortex is also important for dance, for planning of the dance choreography, and so through dancing a person gains better control and better discipline of their behavior and of their body and brain. And here, this figure also shows the brain regions involved which we discussed, but it also shows the functions that they are associated with. The basal ganglia with rewards and motivation, and with forming habits and behaviors. The extended amygdala with stress and anxiety and the fight or flight response. And the prefrontal cortex with decision making and impulse control. And as I already mentioned, these same regions are affected by dance. And this figure summarizes some additional brain regions involved in addiction. We already mentioned the prefrontal cortex, the amygdala, the basal ganglia, also the limbic system, the thalamus, emotions and memories, the hippocampus, which is involved in learning and memory, and the cerebellum is very important in coordination and balance, and the ventral tegmental area, which is very important in dopamine production and in reward. And as we shall see later, these brain regions are also involved in dance. And here, this is a very beautiful figure that I found about the brain dopamine pathways which are involved in alcohol use disorder, and they are also involved in dancing of ballet. And the dopamine is a major neuromodulator and neurotransmitter in the brain that is involved in reward and in movement. And here is the prefrontal cortex, the nucleus accumbens, which regulates motivation and reward, and it is related to learning, and the ventral tegmental area, which is a region responsible for the production of dopamine. And now we looked at the brain regions and neurochemistry involved in alcohol use disorder, and I want to show some slides which relate to the value of ballet as a non-pharmacological therapy for mental disorders. I want to say that I love dancing ballet since a girl, but in the past 2.5 years I have dedicated every day a lot of time to dancing ballet, choreographing my own ballets, and to researching and learning about the therapeutic use of ballet for different human disorders. And And it has been amazing. I'm enjoying this so much. Here, from one very nice paper in Frontiers in Neuroscience, I obtained this figure which shows the brain regions involved in dance, and as we see, almost all regions are involved. From the cortex, many areas, for example, we already mentioned the prefrontal cortex, but the different parts of the motor cortex are involved in the execution of movement. The occipital lobe is important because it connects the visual system to movement. The temporal cortex is important because it connects the sound to dancing. And we already mentioned the cerebellum. Here, the cingulate cortex, the corpus callosum, and the thalamus, and of course the corticospinal tract, which conveys the movement. And this figure also shows the brain regions involved in dance, which we already mentioned, and I'd like to say that both sides of the brain are involved in dance, and this is amazing for all parts of the brain and the body. And some of the benefits of ballet for treatment of alcohol use disorder are summarized in this slide. Benefits for the brain by engaging the same brain regions and circuits involved in alcohol use disorder. Physiologically and non-invasively reversing the pathological neuroplasticity formed in alcohol use disorder. This habit of constantly seeking alcohol stimulates the release of dopamine and other neural molecules that induce happiness, reward, empathy, social connectedness, and resilience. And ballet has benefits also for the cardiovascular system, the muscles, and the coordination. And some of the psychological and behavioral benefits are that ballet stimulates discipline and control of the mind and body. I'm sorry, this should be discipline. Enhances cognition, learning, memory, and sleep. Reduces depression and anxiety. Enhances empathy, social connectedness, and reduces isolation. Enhances confidence, reduces stress, and stimulates happiness, sense of achievement, and overall quality of life. And I would like to conclude this presentation with this quote from the dancer Isadora Duncan. If I could tell you what I meant, there would be no point in dancing it. And in my view, this shows that ballet dance lets you express emotions, which are one of the main reasons people drink excessive alcohol in the first place, to manage their emotions. And for proposals to design and organize ballet classes for therapy of alcohol use disorder or other psychiatric and neurologic disorders in humans, please reach out to me via LinkedIn. And on YouTube you can see my ballet videos, and I have discussed the many amazing both health and artistic properties and benefits of dancing ballet. Thank your attention.